Hello and welcome to Malachi's Message, Toxic Mold Sucks expert episodes, co-hosted by the co-founders of Malachi's Message, Elizabeth Kripe and Emily Rochelle. Here they will use the platform to interview those who are experts in the industry, hoping to give you the tools and resources that you need to be successful in your healing process. Hi, and welcome to Malachi's Message, Toxic Mold Sex Stories. Today we are going over to our expert playlist. I am Elizabeth Kripe. I'm the director and co-founder of Malachi's Message. Emily Rochelle is co-hosting this video. She is the co-founder and board chair for Malachi's Message. Today we have the honor and privilege of hearing from Dr. Riley. Dr. Riley graduated from the University of Oklahoma in 2001 with a bachelor's in psychology. After meeting her husband, Mark, who lived in Cyprus, she moved to the area in 2001. She worked as a mental health professional in a psychiatric setting with children, but desired to further her education. During her educational coursework, she met a chiropractor and found the entire concept very intriguing and decided to pursue chiropractic. She graduated from Texas Chiropractic College in 2006 with a doctorate of chiropractic. Dr. Riley, thank you so much for joining us today.
Hi, thank you for having me.
Hi, Dr. Riley. Thank you again for joining us. Can you tell us a little bit more about what kind of brought you into this chiropractic field?
I always knew I wanted to do something medical. My dad is an ER doctor. My uncle's an ER doctor. My cousin's an ER doctor. My other cousin's a PA. So, I mean, it was just kind of, I knew I was going to do something medical because that's what I grew up with. That's what I knew. When I was a kid, my favorite book was the Merck Manual. I had it in my bathroom. So whenever I would need a bathroom break, I would read disorders and signs and symptoms. I mean, really, I read the Merck Manual. It's kind of nerdy. So in college, I took a lot of courses. I took so many hours because I wasn't sure what I was going to apply for, but I wanted to have all of my options open. I didn't know if I was going to do PA, nursing, MD, DO. My dad's a DO. He's a doctor of osteopathic medicine. So I took all the coursework, met my husband in Mexico. It's a whole different story. Moved here, and I was taking one more course for another associate's, I think. I had so many hours that I had so many different little degrees that I just got because I had so many hours. I wasn't really pursuing it. I met a chiropractor, and with talking to her, she was doing some coursework at the college and some research. Talking to her, she said that she thought I would fit perfectly into chiropractic, and I had never really considered it. I don't have a chiropractor in my family. I thought it was cool that I could heal people a more natural way, and I thought it was cool that I could use my hands. I have really big hands, so I figured I should put them to use. It just seemed cool. I'm not against medicine at all because, like I said, I have such a medical family. I think meds are way overused and prescribed, and the root of the problem is not addressed. You just throw a drug at it to cover up the symptom. So I thought it was cool that I could actually affect the nervous system to help the body heal. So that's why I thought it was just a cool ancillary to MD, PA, nursing, all of that.
That is really, that's really cool.
That's very cool.
And I completely agree with you, about I think that people are just being way over medicated these days and not really looking at what's really causing their symptoms so that they can fix it and not have to take any medication.
Uh-huh. But when people go to the doctor, when they go to a doctor's appointment, in reality, in their mind, they want to leave with a prescription, because if they don't leave with a prescription, the doctor didn't do anything for them.
Mm-hmm.
I have a lot of people tell me when they go see an MD, the MD he doesn't even touch me. He doesn't even feel or make sure. He doesn't lay his hands on me at all. And it's just listening to some signs and symptoms for about 4 minutes, and then a script is written, and then it's done. And I mean, there's no real education on how the patient can help themselves, because a lot of stuff is reversible. A lot of stuff can be helped by them doing the work, but people don't want to do the work. I found that out too. They just want, they're looking for a pill to help whatever they have.
Yeah. And then that pill has its own side effects, which can, lead to, long-term effects.
And then you go back for another pill for a side effect. I mean, it's just like a never-ending cycle.
I agree.
I think it's super cool that I can, not, I mean, it doesn't work all the time. I can't treat pancreatitis and I can't, stuff like that. Like major issues. Sometimes you have to go to the hospital. Sometimes you have to go get the medication, but I can help with a lot of stuff.
Well, one question is, because obviously mold growth in homes is a really big issue these days for people, and obviously it causes a lot of inflammation and a lot of symptoms as well, or how it fits in with your chiropractic office. Like, how does it affect the spine?
It dehydrates you and it just
Okay.
causes inflammation throughout your whole entire system. It causes peripheral neuropathies. It can cause cognitive damage. I can't give you a specific diagnosis that mold causes as it pertains to
Mhm.
chiropractic because there are not a lot of studies done on mold. People don't know about it. It's not in the literature. Um, when I was looking at what I may be getting ahead of myself. When my son got so sick, I was looking things up, and the disorder that he has is directly correlated with people living in third world countries that have very dirty living conditions. And it was strep. It was strep that was his issue. So in the beginning of all of this, I thought, oh, okay, so they're living in dirty conditions and poor housing, so that's why they're getting the strep, because strep is in their housing community. I never even put it together that it was mold that was in their house that was causing these kids to have the strep, if that makes sense.
Mhm.
I didn't learn about mold until 2 years after my son's diagnosis. So I was fighting and fighting and fighting and fighting, and I was kind of like a crazy person trying to figure it out. So then when I found out that I had mold in my walls, it all kind of clicked and all made sense.
And for those that are watching, Dr. Riley and her family went through their own mold nightmare. So, um, and just like Elizabeth and I did too, my husband's chiropractor mentioned to him that the reason why his disc were dislocated was because of the inflammation got so bad. Can that happen where it actually dislocates your disc?
It can it can dislocate a disc, it can cause a disc bulge. It's all about space. In the spine, it's all about space. You have a vertebra that has a lot of little tubercles, tuberosities that a ligament or a tendon attaches to. If there's inflammation anywhere in there, I mean, the space is teeny tiny where the nerve exits. The space where the disc fits is, a set distance. So if you have inflammation in any of those areas, you're going to have pain. The nerves exit the spinal canal and go to the rest of your body. So a lot of people go to the chiropractor for sciatica. So sciatica is inflammation of the nerve root L4, L5, S1. So what that means is the low back, the nerve roots that come out of the low back go down, go down your legs, go down to your feet. So you can have a neuropathy in your foot, your calf, your thigh. And an adjustment works because we take the pressure off of that nerve, and then the sciatica gets better. If you have a constant bombardment of something on the outside, it doesn't matter how many times I adjust you. I mean, you're going to feel better. You're going to feel better for a few days, but if you go right back into the environment or back into the toxic chemical that is causing the issue, it's not going to get better. So it causes just diffuse inflammation throughout your whole entire body. I can't tell you that a certain diagnosis is always seen in mold people, again, because there's not a lot of case reports on it.
How many people on a, I guess, semi-regular basis that come through as clients that see you, is the thought that mold could be the issue behind it? Is that a common thing, or is that something that happens like 1 in 100 patients for you?
It's more than 1 in 100. I'd say 5 in 100. About 5 in 100. Before I went through this, I don't know if anybody talked to me about it or if I just didn't pick up on it or catch it because I didn't understand. But since I've gone through it, there are a lot of people that come through that a lot of it is respiratory issues. They'll come in and they'll say, I'm really clogged up and I have a sinus infection all the time and my kids get ear infections all the time. And all of that is just all inflammation, from the constant bombardment of your environment.
Yeah, I didn't have any issues with my back or anything until we went through molds. And I remember going, man, I have to go to the chiropractor like 3 times a week to get adjusted. For me, it was migraines and congestion. And it, like you said, it would be good for about a day or two. And then I would need to go do it again. And it would be good for a day or two. And we could not figure out. And our chiropractor was like, there's got to be something in your environment that's causing this. And until we put it together, and now looking back going, man, I wish I would have seen those signs as, oh, there's a lot of inflammation. Maybe there's something else going on here.
Yeah. Inflammation is the root of so many things. And I have seen studies about this, like cardiologists have been doing it, doing studies that plaque buildup in your arteries even is caused by inflammation. So a lot of disorders that you would not think are caused from inflammation actually are. Sorry, I'm talking about stories.
It's absolutely okay. No, it was same thing with me, Elizabeth and Dr. Riley. Like all of a sudden, whenever I was in our toxic mold home, I had the worst back issues. Just tons of inflammation in my shoulders and down the right side of my spine. And I never thought that it was mold, but I honestly didn't know I was living in mold either at the time. So, but tons of back issues that I never had before when we were exposed to mold.
The other thing that mold does is it suppresses your immune system. Mm-hmm. So things that you're much longer to get over. And that was our situation too. And again, I didn't learn about it until 2 years later. But it's very true.
So when somebody comes in to see you for your practice, what are some of the things that you look for to make that jump from there could be a potential mold exposure here to it is just somebody that needs to be worked on simply because of their body and other components, not due to possible mold exposure?
Sometimes it doesn't come out in the first visit. Honestly, sometimes it doesn't. I mean, everybody does an intake form when they come in. So I get to see why they're coming to see me, their medical history. Their medical history, if they have, when you go to the doctor, they have the list. Have you ever had painful urination? Have you ever had a stroke? Have you ever, those things. So when you see a whole bunch of those that don't really correlate, that's one of the reasons I start digging a little bit. But just I'm saying a lot of it is respiratory. A lot of it's respiratory. So if I see that they have the bags and the dark circles under their eyes and they can't breathe and they're tired and they're kind of swollen, and again, I try to bring it up gingerly because I don't want to scare people. So it's all different. It's all different. The one I was telling you about that the lactation consultant sent me, very first visit, she came in and she told me that her house had mold. And it kind of took me back like, it's a little odd. This is a little odd that you picked me to come see. So I helped her a lot. She actually just sold her house and she moved to Illinois. So she's out of it. She was very nervous about the whole situation, about what to do. So I would help her along the way. And chiropractic is not, in our scope of practice, we don't treat mold illness. That's not like one of the things we do. But when you have knowledge on it and other MDs do not have knowledge on it, you have to reach out and help those people.
And you also mentioned earlier that you help babies too, right?
Yes. That doesn't really have anything to do with the mold issue per se. No. It's midline deformities. Midline deformities, when they're forming, they have a frenulum that can't move under their tongue, and then their lip is tied. So that's a whole other specialty I have. But I've met people that have mold through that, which I think is crazy. I don't even know how we get on the subject. It's not like when people come in, I say, "Do you have mold in your house?" So that's not my it's not my number one question. It just happens.
So you're not like me where I'm like, it's mold. You have mold in your house.
No,
End of story.
not
I'm
really.
kidding. Just kidding.
But I will tell you, if somebody comes to me and their kid has OCD or ADHD or they started wetting their bed, we treat that, because if you think about it, the nerves that come out of the back go to all of the organs. So bladder, intestines, it's not a chiropractic thing. I mean, you have a spine, I have a spine. We have nerves that go to our body parts to make them work. So I have people that bring their kids in that all of a sudden are bedwetting, and that's a sign.
Mhm.
That's a sign, and nobody really knows that that's a sign. So that little check mark box really helps, because you can put it all together. Some people don't fill it out, which I don't understand. I mean, if you want me to help you, I need to know what's going on.
I think that's so great. I hate that you went through mold, but I think that's so great that you are actually helping people potentially make that connection so that they can get on the right track and figure out what's affecting not maybe just them, but their kids and everybody else so they can get better. I think that's just amazing that you're
Thanks.
doing that.
Thank you. Me too. It was the long road to get over here, I'll tell you that. I've said many times that, like, okay, so I had to lose my house, lose all of my things, like move an hour away to a new place where I don't know anybody, um, to work at this clinic. I really think part of it was for me to get to work at this clinic.
Mhm.
And it would have been just much easier if I found an ad online, or if he called me, or, you know, X all that other stuff out.
So what
Wow.
you, we were talking earlier and you told us, so if people are having some of the things that we've talked about today, or they randomly had to start going to see a chiropractor when they think they might have toxic
Oh,
mold.
you're gone.
Am I gone? My,
You were gone for just a second, but
oh,
you're back.
okay. You guys didn't leave. That
You
was just
froze.
me.
You just had a little blip.
It's like my life. It's okay. Those happen all the time. So what we were talking earlier, and you said if you think somebody might have exposure and they're coming into you with some of the symptoms that we've talked about earlier, what is the one thing that you start to recommend to see if it could be that? You said you asked them to leave for a few days. Is that correct?
Yes. Yes. Ask them to go on a 3-day vacation, see how you feel. Or trying to, nobody wants to keep a diary per se, but, think of when you went to your parents' house for Christmas. How did you guys feel there? Um, that's the main thing. That's the main thing I look for
Do you ever recommend that they get an ERMI just to kind of
all the time. All the time. I recommended 2 people get an ERMI yesterday. I don't even know who the people were. I have no idea who they were. I get text messages all the time. I get Facebook messages all the time. So when I did ERMI, it was through Micrometrics.
Mhm.
I'm not sure. I think there's another site now that does it, but I always recommend Micrometrics just because it was quick for me. They were good. They did a consult with me. So yeah, just yesterday, 2 people, but I don't know who they were. Do you do that too? You talk to a lot of people you don't know?
I tell people when I just pass them the grocery store, you should get an ERMI.
I don't do that. I don't do that.
They're like, what?
But honestly, when I went through mold, I did a lot of testing on my son. My ERMI came back at like 35 or 37. Like, it was horrible. I was running out of money because I was paying $1,500 to a mold inspector every week, paying $800 electric bills for all the air scrubbers and everything that was in my house, in a house that I wasn't living in. So I mean, I didn't have the funds. Insurance wouldn't help, so I did not do any testing on myself. Of course, as a mom, you put all your focus on getting your kids better, right? So I just, and that's the thing also, if you do an ERMI and it's bad, I don't think you have to spend a whole lot of extra money to see if you have mycotoxins in your urine. You do. You're going to have mycotoxins in your urine. You don't need to pay $400 to get a test that says, yes, you have this. I just accepted it and tried to move forward. The other thing that chiropractors can do for this is a lot of detox. And again, I know the Shoemaker protocol, but again, when you're going through this, you don't have a lot of money to go to all these doctors. But we have a brand called Standard Process. So I put together a protocol for my son. I taught him how to swallow pills. And I mean, I had him on, we got little baby M&Ms and vitamin D capsules. And I said, you're going to learn how to do this. You have to learn how to swallow pills. So we did a lot of immune function. We did a lot of detox, bentonite clay. We did vitamin D, zinc, vitamin C. I mean, I had the kid on so much stuff, just a protocol I put together because nobody knew what to do. And it worked. It helped. He's, I don't know, I'd say 95% better. Every once in a while, I'll still see a tick or a facial grimace, and he knows I'm watching. He'll do it, and then he'll look at me like, "Oh, did she see me? Did she see me do that?" But that is another thing. I forgot to mention that. I'm sorry. If I have somebody come in that has a kid that has tics, motor tics, vocal tics, if it comes out of nowhere, I'm almost positive it's mold. Almost positive. But they come to us because the pediatrician couldn't figure out what was wrong, or the pediatrician said their son had Tourette's, or they have ADHD and it's just a presentation of the ADHD. But it's not. It's an outside factor that you have to remove that child from, or it's not going to get better. But tics are a big one.
I get that a lot too. So many kiddos develop tics that whenever I talk to their parents and when they're telling me what's going on with their kiddo, tics are a huge one.
Yeah, and nobody would ever put that back to mold, and even me. I mean, like I said, he was diagnosed in 2016 with acute rheumatic fever and Sydenham's chorea. Sydenham's chorea is the movement disorder that is associated with the rheumatic fever. The rheumatic fever is caused by strep that was not properly killed from the antibiotic treatment. So the strep attacks the basal ganglia in the brain, which is the same part that's affected in Parkinson's. So it's movement. It's a movement disorder. But people don't make the connection. People don't make the connection at all. And I wouldn't either, unless I went through it all.
I mean, baby. Thank you. She decided she was not going to stay in her chair and be quiet, so she wanted to tag along in this video.
That's fine. I like her.
I hate that again that you went through it, but there's a reason sometimes that we go through things so we can help others, and I can only imagine how many people you've helped so far just from what you've experienced in connecting the dots for them.
Yes. I also try to give parents, I try to let them know that they have a voice. A lot of people, when they go to the doctor, they think what the doctor says is like sacred or golden. The doctor's just a person. He's just a person. They don't know everything. I had many doctors tell me, the first neurologist I went to see said that he had Tourette's. He put him on a medication for Tourette's. Mm-hmm. I gave it to him for 2 days and I said, that's not it. I had doctors tell me that he had Tourette's, and I called back and I actually left a message and I said, do you think this could be an infection? And he said, no. Mm-hmm. We ended up in the Texas Children's ER. He got a bicillin shot, which is a pretty strong penicillin product. And when he got the bicillin shot, all of the tics went away overnight. Overnight, they went away. So we got referred to the top movement disorder specialist at Texas Children's. And I showed him the videos. I told him we gave him a bicillin shot. It's gone. He was diagnosed with acute rheumatic fever. And he said, he watched my videos and he said, oh, well, that movement doesn't really look like that to me. And he said, it's quite compelling. Your case is quite compelling, but I don't believe it. I'm like, what? So it was hard to get somebody. And again, this was before I knew it was mold. I just knew that he had rheumatic fever and I couldn't figure out why he kept getting strep. So my poor little boy had to go to the doctor every 28 days to get a bicillin shot in his leg, which hurts really bad. So I wouldn't tell him when we were doing it. I would just go pick him up at school with an ice pack to put on his leg, and then he knew where we were going. That's why I made him start swallowing pills, because I said, if you can just swallow pills, we can just take one in the morning, one at night, and you don't have to get a shot anymore. So he said, I'm in. doctors don't know what to do. Don't know what to do for this. They don't know what to do. Have you heard of Susan Sweeto?
Mm-mm. No.
She is the okay. So you know pandas. I know
Yeah.
you know pandas. Okay. So in my mind, acute rheumatic fever and pandas is pretty much the same syndrome, the same disease. Susan Sweeto is the doctor that coined the term pandas. She wrote up all this research and she was treating all these kids and I mean what she's saying is appropriate. It's caused from strep and it attacks the basal ganglia, but she gave it a new name. The medical community did not like that she gave this syndrome a new name because it was already named. So they discount pandas. There are just a handful of doctors that actually believe in pandas, which is kind of sad because you don't, as a doctor, you don't really believe in a syndrome or not believe in a syndrome. It's not like it's made up. It's like a unicorn.
Mhm.
It's like a unicorn. So anytime we went to the doctor and his diagnosis is acute rheumatic fever, and they would look at his diagnosis, every intern, every resident, everybody in that building wanted to come see Luke because they've never seen that diagnosis before. If I walked in and I said that he had pandas, they would say, "Oh, I don't believe in that." It was baffling to me. I don't like that Sweeto did that with pandas, tried to coin her own term and her own phrase. I don't know if it was just for notoriety or she wanted to have something under her belt. I'm not quite sure. But the pandas diagnosis makes everything so much harder because there are, I would say 95% of doctors don't believe in pandas.
Mhm.
And we would always be like this special case study. Nobody knew why he had it. The shot stopped working. So then we had to go in every 21 days to get a shot, but we were living in mold. So the mold was suppressing his immune system to let the strep come back. But I didn't know at the time. I didn't know at the time that that's what the cause was. We found a panda specialist in Bel Air. His fee was $500 an hour. Yeah. Insurance doesn't cover it, of course. So when I went to him, because I was so sick of dealing with the neurologist and the rheumatologist, the only person that was super helpful to me was my regular pediatrician. And he said, this is out of my scope. He said, he threw his hands up and he goes, "I'm just the ear infection guy." And I was like, "No, you're not. You figured it out. Like you figured this out for me and you have to stick with me and you have to do this." So it's kind of funny that just the pediatrician that coined himself the ear infection guy was the one that helped me figure it out. And when he looked at me and he did a handful of orthopedic tests on Luke, there are certain symptoms. If they hold their hands out, they can't keep their hands straight. Their fingers do this. They're called piano hands. When they stick their tongue out, their tongue, they can't keep it in their vine. It goes off to the side. So that's how we initially got the diagnosis. And he said, "I've never seen this before." And he actually had to pull up orthopedic tests on his computer to figure out what to do because it's so rare. But the thing is, it's in my mind, it's not rare. It's not that rare. People just don't make the connection. So I think part of my journey on this and part of my, I guess, my great worth in this is to let parents know. And I'm not saying don't listen to your doctor. I'm not saying that. But if they're not educated properly in something, they can't help you. They can't help you. And the ones that I've run into, except my pediatrician, were not interested in learning about it. And when I finally figured out it was mold and I put it all together and I called the pediatrician and told him, he said, "I don't know anything about that." But when he saw the pictures of Luke and he saw the changes in Luke and the kid gained 60 pounds, I mean, just from moving out of the mold and doing all the detox procedures that I did with him, he couldn't believe it. I actually offered Luke to Texas Children's. I was like, "Do a case study. Like, do a case study on him. I'll sign all the forms." And that top movement guy, he was not interested at all because the movements didn't match textbook. I was like, "Okay, all right. Well, I'm done with you." I fired so many people. I can't tell you how many people I fired.
That was one of my biggest issues, whenever I found out it was mold, was that my son's pediatrician looked at me straight in the eyes and told me, no, it's not mold. When he had just considered just telling me, you know what, Emily, I don't know, I would have still continued thinking or looking into mold. But because back then, I thought that, doctors would know. And a doctor wouldn't tell me yes or no unless he actually knew if it was yes or no. That made me not continue thinking it was mold. So I continued to stay in that toxic home. And so that was my big issue, is when they don't know what they're talking about and they say no.
Yeah.
Or so
it's okay. I think it goes back to that ego thing, because they don't want to not know.
mhm.
It's okay to not know, and it's okay to tell somebody that and say, I don't know, but I will look into that for you, or I'll do some research, or I'll try to figure this out for you. That's not a bad answer. That's actually, people appreciate that more, um but the training in medical schools, they don't include that. My dad is a shock trauma surgeon. His specialty was gunshot wounds and stab wounds. You don't want to see my dad unless you really, really have to. But he works with a lot of residents and interns, and he was at a teaching hospital. So this was a couple of years ago. He said there was a neurology resident. Her specialty is only neurology, and she was going into movement disorders. And my dad said, have you ever heard that mycotoxins can contribute to a tic disorder? And she said, no, I've never heard that. And my dad said, just type it into Google. Just type it into Google right now and see. And she did. And she was baffled that there were some case studies that mycotoxins were causing this brain inflammation in kids and the tics. So this girl this was just a couple of years ago. She's a neurologist that is going to specialize in tic disorders, and she has no education on mold at all. So I was proud of my dad.
That's amazing.
Yeah. So he's like I said, he's a teaching doctor. He would work in the hospital, but he always had interns or residents or somebody with him to teach. And he has helped by bringing it to light as well. And he didn't have education in mold. He's in the ER. It's life or death. You got to keep somebody alive. So I'm proud that he brings it up.
It's huge. That reminded me of this one story. I'm sorry, I'm kind of going off topic, but there's a neurologist somewhere in Houston that probably just saved this one girl who's about 14, who was extremely bright, straight A's, social, and all of a sudden the doctor's diagnosing her with autism at like 14. Like, never had any issues, but all of a sudden she developed extreme anxiety, couldn't retain information anymore, had tics, started to just like become depressed, and she was scared of everything. She was hallucinating. She had all these issues all of a sudden start to pop up over a year. And her doctor knew this neurologist who actually started telling her doctor to think mold. And sure enough.
And this is somebody in Houston?
This is somebody in Houston. It's a neurologist who actually deals with kids that are autistic. And he's now, or she, I don't know if it's a he or she, is now starting to look at mold potentially, just like with my son, who got diagnosed as autistic. He's not anymore because it, was mold causing all of his symptoms. But now that doctor is looking at mold as potentially being the culprit, and, some of his patients, some of his kiddos that come to him that are, develop all these symptoms out of somewhere. It's not, these are kids that regress into,
Yes.
autism, not born with it, but kiddos that all of a sudden start to have these challenges and symptoms. And so because of that neurologist, and I don't know who it is.
I need to find out.
Yeah, I want to find out too. But yeah, he or she told this girl's doctor to start looking at mold as potentially being an issue, because that's what he or she is seeing as well.
That's great that there's somebody out there that is making the connection, because it's really, really, really hard to find somebody that does.
Maybe your dad, maybe it was, your dad saying something to that other neurologist who told who knows? You know,
Yeah.
you never know how what you say may actually trickle down and affect other people and help them.
I totally agree with that. And sometimes you don't find out about it until months later, but you think, oh, it's kind of cool that I got to help you.
Yeah.
Um, I kind of became disenchanted with the rheumatologists and the neurologists and, all these people that are supposed to specialize in this. And nobody knew what to do because, this only happens in a third world country. His diagnosis, nobody knew. So I kind of turned into a crazy person when he kept getting strep. He had to, I'm telling every 21 days we had to get the bicillin shot. And then every 21 days he would have strep. He would have strep, we'd get the shot. It would go away. He'd have strep, we'd get the shot. It'd go away. So I bought a lot of strep tests online and my dad gave me a strep test kit from his clinic. Everybody that came into my house, I would like swab you. I stuck a Q-tip up my dog's butt one time, just making sure that like she didn't have strep. I called the vet. I got my dog on antibiotics. I swabbed my pool. I mean, my kitchen looked like a laboratory with all of these little strep vials. I mean, I was chasing and trying to figure out why I kept getting this. I called the previous homeowner. I was like, did you get strep? What, did anybody ever have strep when they lived in your house? And she said, no, like I've never had strep in my whole entire life. But then when I found out that we had, I only did the test on Luke, but Luke has the genetic component where he cannot detox the mold out of his system. It made total sense that being in that house and that mold suppressing his system for so long, he couldn't fight the strep off. And I'm somebody that when I get an antibiotic, like I give you all the antibiotic, I'm not going to stop. A lot of people do that, and that's bad. That's really bad. Don't do that. So I couldn't figure out why it was happening, and I mean, looking back now, I think I kind of look crazy, swabbing my dog's mouth, her nose, her rear end, her. Just trying to piece it together, trying to be an investigator.
Well, I think we all kind of look crazy whenever we were trying to figure out what the heck is going on.
Yeah.
I was looking up everything. I was even looking at like, okay, tampons have these chemicals in it. Maybe it's the chemical on a tampon that's causing all these issues.
Oh yeah,
It's just you don't know because again, you're kind of like thrown in a desert and you don't know which direction is north, east, south, or west. And you're just looking around like, well, where do I go?
Yeah. I do feel very fortunate. I said, and Luke has even told me this. My son, he's 11 now. He's at camp right now. He's coming home today. We have to go get him in a little bit. This is the first summer he's been able to do a sleepaway camp because he was so sick for the past few years. I wasn't going to send him anywhere because he could get strep, because where do you get strep from other kids? But I have told him many times that I'm so happy that I'm his mom because I don't know and he's told me the same. He said, I'm so happy that God gave me you because you fought for me, because he felt like absolute crap, but he didn't know how to verbalize that. He said he always felt very tingling and his body felt numb. And he had all these symptoms that a kid can't convey to an adult or even to a doctor. So I got his diagnosis in a week. It took me 1 week. And I hear of so many parents that have pandas or acute rheumatic fever or whatever you want to call it, that don't get a diagnosis for years and years because nobody will listen to them. So I take it on myself that whenever I see a kid, I always ask, just a little bit of questions like, did anything happen suddenly? Did you move and then something happened? Did they start a new school and then something happened? Because a lot of times I don't really like this, but a lot of times I'm a last resort because they've tried the pediatrician, they've tried the neurologist, they've tried this, they've tried that. So now they're going to come to me. I do acupuncture as well. So they come to me for acupuncture and an adjustment. We have a cold laser that works on the same frequencies as the cells. So I can do laser on there. I can do laser on the brain, on the cranial nerve 3, on a stomach. I mean, I have a protocol for anything. So when they come to me as a last ditch effort to try to figure out what's going on with their kid, that's another like red flag to me that there may be something in the home that nobody knows to look at. When I was going through this, I feel bad saying this, but I wished that the doctors that I saw would have a kid like this. Like, I just wish your kid could up one day and have tics like this and see what you would do. You're not gonna, I mean, you're not gonna, if a doctor says, oh, he just has Tourette's, you know, he'll grow out of it, or it'll get better when he's 18. Like, you don't take that as an answer. You don't take that as an answer. So I really work hard to try to be an advocate for parents. I am always sure to listen to them. I make referrals when I can. But a lot of imaging doesn't show, especially for spines. I mean, you know, mostly we just look at like disc bulges and bony issues. It doesn't show up. It doesn't show up. So a lot of it is listening to the parents, and the parent knows their kid best. So I don't know why doctors don't make that move. I just don't get it. So I feel like I have been placed at this clinic, and all of these people that come in that have mold issues, like, it was just meant to be. I don't know how else to explain it. I don't know how else to explain it. And I love kids. I love kids. So I mean, it's great that I get to help kids so much.
Can you tell us where you're working right now, in case there are people that see this that actually do need somebody?
Yeah, it's the Alternative Health Center of the Woodlands. It's on Technology Forest, by the Black Walnut Cafe. We're in Suite 250 upstairs. It's a great clinic. I mean, the guy I work with, his name's Dr. Clothier, and he does a lot of functional medicine type stuff. And now he's even kind of getting into mold because of me. And after he met me, he's had a few patients call me to have talks about this, because he said, I think this might be what they have. But again, if you don't go through it, you don't know it.
Yeah.
You know? But I mean, he really thinks outside the box, and he's a super helper. Like, he helps. He does a lot of functional medicine type stuff and nutritional and supplements. But the bottom line is, if mold is causing your illness or your symptoms, you have to leave the mold. I mean, I can adjust you 100 times and you'll feel better, but I don't want you to come see me 100 times and pay me 100 times. I want you to get better faster. Like, that's not my MO.
No, I was just going to say thank you. This has been amazing.